I'm a clinical psychologist. I've been doing addiction treatment research, program development for about 35 years. And really from day one, kind of fell in love with the whole thing. I think mostly with the humanity of it, people's lives changing from just incredibly difficult, painful places to more hopeful places to back to incredibly difficult places, but often just having a sense of moving forward, a sense of reclaiming myself as a human being, reclaiming my values, my integrity, my sense of ability to care about myself, and just watching that in other people it's kind of doesn't get better than that.
It is an enormous change when people make that decision to start over and to give up their substances.
Yeah.
It is the beginning of a beautiful and frustrating and crazy and lovely journey.
And back and forth and jagged and
Yeah, recovery is not linear.
Yeah.
It's a lot of ups and downs.
Yep. And I think that you saying that also reminds me, it's not a sense for me, at least, and I think for the work that we try to do of people being broken, it's a sense of you've lost some important parts of what you want to be, and you're fixing some things that are fixable. That makes sense to me. And can we try to help fix those things in some other ways that don't have such a downside and don't hurt you in so many other ways or hurt the people in your life? It's not that there's something wrong with you. It's that you're solving these issues in a way that's got some really serious problems going along with it, as opposed to I'm somehow coming in and fixing something. I'm not. I'm coming in and helping discover something together,
I think that's an important message for parents to hear. Your child is not broken. We don't want to try to fix your son or daughter.
Right.
We want to help them return to their essence, to become a productive, happy human being, if possible.
Yeah. They are fixing something for themselves. We're really trying to let them find their way back out again and solve some of those issues in ways that are more productive.
Why is the concept of invitation so important and so effective?
Well, the second part of that is why it's so important.
Okay.
Because it's effective. And that's something we know about behavior change, and it doesn't have to be related to substances at all. If you're trying to be in a helpful role with another human being around change, demanding it, mandating it, dictating it, prescribing it are some of the least effective ways we know to try to help somebody make those changes. Certainly one of the things that's true about substance issues, especially when they get into kind of the more severe range, is that they're not quick fixes. This is going to be a long-term thing. So really, really what you want is to figure out ways to help sustain change. Getting a change to happen, not that hard. Getting it to last is really the hard part. And that's where the difference between mandating change and inviting change comes in.
Invitation rather than confrontation.
Yeah. An invitation is a slower path, which is a hard thing for parents. It's a hard thing for professionals. Your behavior is scaring me. It's upsetting me. It's upsetting everyone. Something really bad can happen. So the impulse to demand change is really strong. And it makes sense also, as a parent to say, this has to happen. This has to be different now. And if that was the most effective way to have change happen and to sustain it, we'd be like, that's awesome. Let's teach people how to demand change. Let's teach people how to be more confrontational and yell louder and be more demeaning. It doesn't work. It may work for me as a doctor with someone in my office. It may work to say, this is what has to happen. And I'm the doctor and here's why it has to happen. And I might be able to get compliance today, but I'm not there at midnight when you really want to use cocaine again. So if you're not there with yourself kind of guiding the ship, we're not getting anywhere. So everything I can do to have you buy into and understand why this might be important for you is going to be stuff that helps you sustain this. Tonight at midnight when I'm not there, next week when you're on vacation when I'm not there, and in 10 years from now when your wife and you are divorcing and I'm not there, there better be some reasons that matter to you to not go back to the cocaine. Like, who cares what I think at that point? I could mandate it and use my power, or I could use my power as a parent with my 16-year-old to say, you have to do this. Who do you think you are? So there's power in those relationships that can get some response in real time, and the response doesn't last. And that's the problem. I want it to last because that's the long-term gain.
Is that why this holistic approach is so important? Because this is not just black and white. There's a whole process that has to be taken into consideration.
Well, the whole process, I think one of the other words that's important in this whole process that's related to invitation actually is motivation. Having someone's motivation shift and become more internalized and something that they're doing for themselves more is also not a one day to the next process. We talk about this idea that behaviors make sense, and it has a lot of implications. But one of them is that I'm doing things for reasons that make sense to me. If I'm going to change those actions, that I drink, 6 nights a week to the point of intoxication, I'm doing that for a reason. If there's no other reason that makes sense to me to do something different, I'm not going to do it. And that's motivation. What is my motivation to do this differently? If there is no reason other than you told me not to do this anymore, that's not a very good reason. I don't actually care about that reason for very long. I care about it right this moment when you're about to ground me. But the next moment, when you didn't ground me, I'm good. I'm good to go. Because there's no reason for me to not do the old behaviors anymore. If we had a collaborative relationship, and if we were starting to figure out ways that I might be doing something differently, and those reasons for doing something different than drinking started to make sense to me, then that's going to start to lead to longer term change.
The invitation to change approach is made of 3 parts, and I want to go through each one with you. Understanding, awareness, and action.
Yep.
And I'm sure for parents watching this, they need to know that their child wants to be seen, heard, and understood, right?
Mm-hmm.
So why don't we start with this concept of understanding?
Yep.
And, I'm just wondering if a lot of parents say, oh, well, I do understand my child. I've known my son or daughter since they were born. What do you mean I don't know my child?
Well, that's a really great place to start because, in fact, they do know their child. And they know their child better than anyone else. And one of the problems we run into in the substance use field is that we treat everyone like they're the same. So if you're a parent and you're coming to a traditional provider, often what you're going to hear, regardless of who your child is the same message about your child. And that can't possibly be true, that your child is the same as her child is the same as his child. They're all different. And their reasons for using substances and your reasons for wanting to bring them here are all different. So if I have one answer for the issue of substance use disorder, I'm missing out on exactly what's going on for each of those kids and each of those families.
One size doesn't fit all. One diagnosis doesn't fit all.
And one definition of substance issues doesn't fit all. We have a training video that we developed for parents and for loved ones that sort of an idea of ordering shoes online, getting them, trying them on, having them not fit. And if you called the shoe company and said, this is 4 sizes too large, their response to you would not be, well, I think that's more about you than us. And you really need to work a little harder to make those shoes work. And apparently you're not committed to those shoes. And we see this all the time. And you need to kind of just push yourself a little harder. That's what people hear when they call treatment centers. My kid actually has some really serious issues with PTSD and anxiety. Is that something you guys work with? Look, we work with addiction, and that's the primary thing. And you need to understand that your child is an addict, and that's what we're going to deal with. Well, then we're probably missing a lot. If that's the answer we're getting, you're not understanding that my child has very specific issues that need help. The other thing I would say about the one size doesn't fit all part of this is it's a message for a family too. It's a message for a parent. What is going to work for one family in the way they want to help is not necessarily the same that another family is going to want to, path that another family is going to want to walk down.
If you talk to 100 different people with substance use disorder and you ask them about their experiences with addiction, you're going to get 100 different answers.
Correct. And we sometimes, as treatment providers, train people to say the same thing. I'm an addict. That explains everything. Well, it kind of explains nothing, actually. What does that even mean? You still have a different story than the person next to you. And the kid coming in with their parent has a different story than the next kid coming in. So that's just an invaluable resource for us in this change process, for that parent to understand, yes, you're right. You do know your kid better than anybody. You have so much information you could be giving me. Think through who this person is in front of me and respond appropriately to that person, not to addicts or to people with substance use disorder.
And that's something that we are doing here on the Real platform, is really explaining the disease and how it affects the entire family,
Yep.
and that their child is unique
Yep.
and needs to be treated
Yep.
as such.
Yep.
You told me that it is important for parents to understand that the substance use and abuse makes sense to their child.
Right.
So for parents watching this, what does that mean?
It means, how could I possibly understand your story if I don't listen? And that's kind of a foundational skill for anybody in a helping role. Parents are in a helping role. If I don't understand how to listen to you as my child, and I might not be used to doing that, because there's often hierarchies in families and parents don't listen to kids, kids listen to parents, or whatever the traditions may be. But if we can get people to listen, then they will start to hear what those reasons are. There's so many outgrowths of that, just that slowing down long enough to pay attention. When someone is actually paying attention to you, it has an impact. And if you do that with your kid, they'll notice. That doesn't mean day one, they become a chatty Cathy with you and start telling you everything. But day 10, month 3, they're going to be speaking with you more than they might be. And that leads to an incredibly powerful difference in this invitational idea, which is maybe we can collaborate about this, as opposed to I'm going to tell you what to do and you're going to do it or pretend to do it and then not do it. And if we can collaborate, you're going to start to tell me stuff that is uncomfortable for me, but you're going to start to tell me stuff that I really want to know about, like what you do actually when you use substances, or how much you actually drink, or even maybe why you do these things.
Do you find that parents really are scared to ask these questions?
Totally scared. Yeah. And the first 6 times I might get some bad responses like, are you kidding me, Mom? And I'm leaving the room right now. But if I'm actually asking you, you know what? It scares the crap out of me that you drink a lot, but I just really would love to know what you get out of it. And I have nothing else to say about it. I'm just really curious, like what that's like for you, because I don't get that. I don't drink that much and I don't understand what that is, but I'd love to hear from you. And like, let's have that discussion.
And that's hard, isn't it?
Really hard, because really I want you to change. But if I want to walk down that path, I need to spend some time just hearing you so that you'll feel like maybe it's okay to collaborate with me.
You know, the second part of your approach is awareness, which seems really similar and part of understanding.
Yeah.
But how is it slightly different than what we just talked about?
It's kind of taking the whole thing back to yourself. Understanding is, can I understand you? And awareness is, can I understand me? Another way we say that sometimes to parents is, you know what, if you're going to be most effective at this, you need to be part of the change also, which is not necessarily something they want to do, not necessarily something they signed up for. Of course, they didn't sign up for any of this, but them being invested in this, not I'm going to stick this through and I'm going to make sure you keep getting into treatment. I'm going to do all that kind of stuff that parents want to do and they want to help fix things and so forth. That's one way of staying connected. The other way, though, that we're talking about staying connected is becoming aware of yourself as a person in this process. And it's a crucial part of helping change occur. So I can listen, but if I'm churning inside and boiling over and so angry and I'm sort of out of control with my responses and just in a reactive mode a lot, I'm not actually going to be very effective, because then I might listen this moment and the next moment I'm yelling at you again.
So that reactive response is not effective. So it's more, how can I learn how to respond rather than react?
Or be proactive instead of reactive. Like I'd like to head into situations thinking through what would be useful actually. Where would we like to get to in half an hour? I can have 2 different versions of this discussion now for the next half an hour. When you walk in the door and I know you're going to be intoxicated, That's not a surprise. That's happened 27 times. So I can be proactive and say, you're going to head in the door in 20 minutes. You're 2 hours late, like every other time. And if I'm going to be proactive, where do I want this to go? If I'm going to be reactive, where will it go? So if I were to be reactive, I'm going to be mad. I'm going to be hurt. I'm going to feel betrayed. I'm going to be yelling at you. You'll slam your door. You'll get up late tomorrow. We won't speak all day. And I'll feel an awful pit in my stomach all day. And then you'll go off to school on Monday morning and there will be. There's nothing not predictable about that entire sequence.
Okay. For parents who are watching this and who just heard that and they go, that's it. That's what we go through every weekend. What could you tell them?
That's why we talk about awareness. So can I hit the pause button and go, this is going to be difficult, what's about to happen. It's painful for me when my kid comes home intoxicated. It doesn't need to be a surprise because I know it's going to happen. So where would I like to be in a half an hour? Where would I like to be Sunday morning? Where would I like to be Monday morning? And how would I get there? And where I'd like to be is talking to my kid. Where I'd like to be is feeling connected and not angry. Those would be good things for my heart. And those would be good things for us moving forward in a good way together. I need to recognize the fact that I'm sitting here stewing for 2 hours and not ignore that and realize that my heart is racing as it's getting closer to the time I know you're going to get home and that my blood pressure is up and that there are things I could do to help with this right now. If I'm not aware of those things happening, I'm not going to do anything other than what I always do, which is to be reactive. If I know what's going on with me, then I have a choice. When you do know what's happening, you can be proactive. You can choose, here's the path. Look, I may yell at my kid anyway, but I also may really change my path and go, you know what? I'm going to go to bed. I'm going to make sure I don't interact with them because I'm not going to control myself. I'm not going to be able to not yell. So let me be proactive and go to bed right now and stay in my room and pretend I'm sleeping because I'm not going to sleep.
And so that's not necessarily running away from the problem if the parent goes to the bedroom.
That's the parent saying, what matters to me? What's of value here? I don't want to have yet another fight because I know where that goes. I'd like to have things feel better tomorrow because you want to stay connected with your loved one, whether it's your spouse who's having a hard time or your kid or whoever it is. We want you to stay connected. So what do you need to do to take care of yourself, to be aware of yourself so that you can stay connected?
So the third part of your invitation to change approach is action. Mm-hmm. What does that look like?
Two big parts of that. One is communication. And communication, especially when someone is struggling with substances, is usually the thing that has gone completely into the toilet and is just going really poorly. And that might look like all we do is yell. All we do is slam doors. That's our new communication strategy. All we do is be shut down all the time and we don't talk at all. And those are not awesome communication methods and don't usually take you where you want to go. Just very straightforward ideas about how to listen, as we talked about, how to ask questions in a way that are going to elicit answers as opposed to shut the other person down. So that's one set of tools is how do we communicate in a way that we're actually going to be able to hear each other and feel safe communicating. And the other part of the action tools is behaviors, and learning to reinforce positive behaviors is the big part of that. In the context of a family when things are burning and going badly, kind of the last thing I'm noticing is anything positive. And it's kind of remarkable the impact that noticing positive things has. So if you're my kid and we've been fighting for a year about your pot smoking, and most of the time we're just fighting, and most of the time I'm feeling disappointed or scared, and most of the time you're feeling blamed or upset with me or unappreciated, if I can actually start to appreciate even things that have nothing to do with substances, like I really appreciated you getting home on time, or I really appreciated you having such a gentle way with your sister yesterday, that meant a lot to me. There's nothing to do with you smoking pot. I'm still mad that you're smoking pot, but I'm actually able to point out something else that's going well, which has a remarkable impact on human beings when you say, that was really cool.
Yeah, it certainly does. Yeah. You know, especially for a teenager or a young adult, I would think.
Again, it's not the same as, and I agree with what you're doing, but most parents know a lot about the ins and outs of their kids and why things are happening. And I would know that my child is smoking pot, I may be mad about it. I may feel like that's crazy behavior. Why are you doing that? That may be my first response to it. But if you slowed me down and said, well, why is he doing that? I'd say he's a really anxious kid. Like, I know all the reasons why this is a substance that my kid really appreciates. You realize also the level of empathy that you're then going to draw out of that parent as well. They love their kids.
Yeah.
They would do anything for them. They've been backed into a corner by their own fears about it, and they're upset and all that kind of stuff that's going along. But it's also a tool then to say, can you remember your kid? It's your kid. Like, yeah, they're smoking a lot of pot. You don't like it. Okay. And they're your kid. And what do you know about them? And what do you love about them? And can we help you get back to some of that stuff as part of this process of engaging?
You talk about how important it is for parents to promote collaboration with their child rather than fighting.
Yep. And if we can establish that more collaborative relationship, you're going to talk to me. You're going to come to me. You're going to ask for help. You're going to say, I'm in over my head. I'm reminded of what a parent actually said to me recently. Look, my kid is still struggling enormously. But what happened a couple of months ago is that my kid came out of their bedroom and told me they were overdosing, which makes me want to cry every time I think of that. But the fact that they had developed for 6 months prior to that a collaborative relationship meant that their kid came out of that room and said that to them, and they were able to help them live. If they didn't have that, that kid would not have come out of that room. They wouldn't have gone into that room, and that would have been the end of that.
What an important message for our parents to hear.
Yeah.
Thank you for sharing that story. I want to talk about ambivalence for a moment. How do you help parents understand that ambivalence is normal and that their child is definitely going to have mixed feelings about giving up substances?
Yeah. One of the easiest ways actually is to just take it back to the common experience for all of us as humans. So we can take it out of the substance realm and say, is there anything that you have wanted to change in your life that you haven't quite changed? Then you can get out your piece of paper and make the long list of things that are on that list. Well, I'd like to exercise more. I should cut down on my smoking. I would like to work less. I'd like to take more time with my wife. Really? Okay. What happens with those things? Well, things get in the way. That's just a way to help people understand ambivalence. I'd like to exercise more, but I love spending time at home and watching my favorite shows. That's ambivalence. There's nothing wrong with it. It's just wanting two things that matter to me. And if we can take that idea and bring it back to substance use and say, and I'm really anxious, and when I smoke pot, I feel much more relaxed. I would also like to be abstinent and going to yoga class at night and relaxing and going to sleep that way. That seems like a nice idea. And smoking pot seems like a really nice idea too. And that helps me also. That's ambivalence. Nothing pathological about it. It's just two things that are pulling me, both of which work. And how do I decide those things? So I think trying to help parents, anybody really understand this is a natural thing that happens about change. We can't erase those things from your brain. My brain will know forever and ever that pot makes me feel less anxious.
So there is no erase button in our brains.
Correct.
Sometimes I wish there were. I'm sure parents feel the same way, but it's okay that the voice I still want to use is out there.
Yeah. And actually, it's a great point you're making, because if I, as a parent, can start to understand that that's actually even helpful for me to be able to hear that voice in my kid and not be scared by that voice. I think many parents have the experience of like, I want them to not be thinking about this anymore. And if they bring it up, that means they're thinking about it, and that must be a bad thing. And we think exactly the opposite. Of course they're thinking about it. And if they're pretending they're not thinking about it, you're only seeing half of what's going on. And that's exactly the opposite of what you want. I'd like to know what's going on. And of course, you're thinking about this sometimes, and you can feel okay telling me about it sometimes. I'm not going to send you back to rehab because you told me you wanted to smoke pot again.
Okay, you just touched on something important. Parents who are taking our course may think, oh my gosh, my child relapsed, or they shared that they wanted to use. They need to go back to treatment. But you're saying not so.
If my kid is telling me I'm thinking about pot at times, my response to that would hopefully be more along the lines of, first of all, thank you for telling me that. Appreciate that. Second of all, what are you doing with that, Joe, when you want to do that? Does that make you smoke or not? Or like, can we talk about that? I'd love to hear about what happens. Third of all, would you like any help with that? How do we collaborate about this? If my response is go to rehab, that's not collaborative. That's me saying, here's what's going to happen now.
And it's not compassionate.
And it's not particularly compassionate, right?
Just you're going back to rehab and that's that.
Right. And we're not having a discussion. So you're not actually a person in this discussion anymore. It's me. And here's what's going to happen to you. Why would you ever tell me things if that's what's going to happen? If you have no say, no vote anymore by self-disclosing, that's bad path to take.
Do you think that parents sometimes think if they're compassionate, that's actually giving their child permission to use?
Yes. I think that parents think that, yes. And it's not true. Typically, compassion would allow their child to feel safer and closer. There's a difference between compassion and turning a blind eye towards behaviors. So I can say, it freaks me out how much you're smoking pot and still have compassion for you, saying you're a bad kid. And all this pot smoking you're going to amount to nothing if you don't get it together here. That's not particularly compassionate.
And that would make me want to smoke more pot, quite frankly.
Right, exactly.
When we're talking about long-term recovery, we often hear the phrase, time takes time.
Mm-hmm.
I like that phrase because I know that anything worth doing is worth doing well. And if it's going to go well, it's going to take some time.
Yep.
So when you practice, you learn, right? And that's the same for working with your child and being compassionate and inviting them to change, right?
Right. Well, if you think about what inviting someone to change means, it means you're asking them to do something new. You're asking them to do something different than what they're doing. What could be different is I'm now doing yoga instead of smoking pot. That's a new behavior. It would be like saying, would you play these pieces on the piano that I have over there in that open Beethoven book there? I love that music and it means a lot to me. And it would mean a lot to me if you would just play that for me, even though you've never played piano before. That doesn't make a lot of sense. If I said, I would love to have that be the place where we get to, where you can play those pieces and I get to listen to them. If you'd like to, it's going to probably take you the next 4 years to learn how to do that. But that's how you would get to that place, is you would have to practice and take the time to do that. For me to expect for you to be able to do those new behaviors because I want you to, because I'm scared if you don't, because it's dangerous that you're doing these old behaviors, that doesn't matter. I still don't know how to do those new behaviors until I take time practicing them. And I would say the same thing in terms of self-compassion around all this, all these ideas. As a parent, you also are going to be doing new things. We're asking you to learn new ideas. We're asking you to learn new practices of communication. Those will take you time. You will not be good at them at first. And to have some compassion for yourself in learning those new ideas as well.
Do you believe in boundaries?
Sure. And boundaries are something that are important both for the person who we're asking to make some changes and for ourselves. When we think about boundaries, we're often saying, you're violating things that I care about, and I'm going to set a limit around those. And setting limits is a really important behavioral feedback loop for anybody. When you do such and such a thing, here's what's going to happen. It's an incredibly important part of behavior change to be clear with people about what's okay and what's not okay from your perspective, and to be clear about what the consequences of that are. So the issue of boundaries to me is much more intense in terms of helping people understand how to set those up. Sometimes it can just be, this behavior is painful and I want you to stop it. But the more important part of this is, how can boundaries be a moment of learning? We talked about this. We said if you came home intoxicated, the consequence was we weren't going to be paying for your cell phone anymore. So that's what we're going to do for the next month. And then we can talk about it again. So boundaries are important. Boundaries are important for clarity about what behaviors are okay and what behaviors are not okay. The other part about boundaries, though, is that offering the person a way to get back the thing that may have been lost, for instance. If there's a consequence for a behavior and I'm taking something away, is there a way for me to get that back? So I'm not like permanently in the doghouse for this behavior that it's happened. Because that's a lose-lose kind of situation for most people. Back to the question about practice. I don't need you to be able to play the whole concerto right now. Would you be willing to sit at the piano for 2 minutes and plunk at it? How do we facilitate that? Because I know that the concerto is too much to ask right now.
It's really quite a perfect example because, expectations can be quite dangerous.
And suffocating. And what they do is they kick up resistance as opposed to collaboration. The long term here is what matters. So I want collaboration. I want us to work together. If what I'm doing is making you back against the wall and want to run out the door, then obviously we're doing something that's going in the wrong direction.
And when we work together, we're going to be more effective.
Yeah. And one of the things that I think sometimes happens for parents when we talk about, can you help by understanding your child more deeply? Can you help by becoming more aware of yourself, having more self-compassion? Is that it can sound like, can you just be nice and just love each other and it'll all work out? And that's not really what we're saying. We are saying, can you start to hear each other? And we are saying, can you start to create a space and a relationship where real change can occur? So there's all kinds of tools in the toolbox about reinforcement and communication strategies. And the whole REAL program that you guys have developed is got a ton of tools for how do you navigate treatment systems and how do you talk to treatment providers and what are treatments and what are medications and all those things that are the kind of the nuts and bolts of the toolkit. What we're talking about is, can we help establish a relationship that's going to allow those tools to be used effectively? Because we want to use the tools. We want change to happen. Things are dangerous. My kid could overdose. We're in the middle of one of the worst epidemics of opioid use and overdose that we've ever seen. So the stakes are incredibly high. So this is not about, can you just be nice and relax and take a breath and do yoga? This is about, can you do the incredibly hard work of understanding another person, of understanding yourself, so that you can create the conditions for change, so that you can use those tools effectively.